Good morning and welcome to another podcast from Biotechnology. Today we're very fortunate to be joined by Dr. Amanda Caples, the Chief Lead Scientific Officer for Victoria. Amanda is a leader in regional and sub-national technology policy, specialising in the development of future industries for economic growth in Australia and more specifically Victoria. Hello, Dr. Caples.
Good morning, Stephen.
It's lovely to see you and thank you for joining us today. I was wondering if you wouldn't mind telling the audience a little bit about your background and how you ended up where you are today, please.
Okay, so my background is pharmacology. So I completed a PhD from the University of Melbourne and went straight into industry. So I was an experimental pharmacologist, and my first job in industry was actually to undertake clinical trials here in Australia for a French company, Servier Laboratories. So that was my entree into the industry, and I had a number of different industry jobs in the biotech industry, where I undertook a variety of clinical trials across many different therapeutic areas, and then moved into licensing, business development, and new venture creation. From there, it was all about how do I leverage that experience in a public policy sense, and that's what led me to the Victorian government, where I have, as you indicated in the introduction, have been specialising in technology development at a subnational level.
Okay, so you've been involved in a lot of very interesting projects since you've taken up the office in Victoria. And I think we could definitely talk about your incredible, remarkable past, because I think you're being very modest. But can you tell me something about some of the accelerator programs that you've kicked off in Victoria while you've been in the office or you've been part of? Please tell me something about the mRNA workshops that have been going on in Victoria.
So over the past 20 years, the Victorian government has really doubled down on investment in Melbourne's biotech community. And so we were well placed in 2021 when mRNA really became a therapeutic modality of significant interest. And so we were able to build on top of our biotech industry, which we've been developing for 25 years, and expand rapidly into the mRNA technology development space. And we did that by using a number of different approaches. So, and these all occurred simultaneously. So it was really very much a case of flying the plane as we were building it. And what we did was to attract the investment from Moderna to underpin and develop a manufacturing facility here in Melbourne that will deliver commercial scale vaccine for local purposes. And alongside that, attracted investment from Biotech to create effectively a foundry of clinical scale RNA material to support our emergent discoveries and to accelerate the translation of research into practical outcomes that could go into clinical trials. So we had that international approach, which was really injecting global capability into our system. But alongside that, we also invested in two approaches to develop the local system. So the first approach was to support the progression of early stage discoveries from our research institutes and our universities by providing grant funding to accelerate the progress of those grants. And secondly, we invested in broad-based platforms that support the delivery of mRNA, both from a formulation point of view, but also as in any therapeutic modality, there are intrinsic questions that need to be addressed as one is developing that kind of product. And so we invested in what I would call platforms that support the implementation of an mRNA approach. So, for example, around inflammation, having a test bed, if you like, where mRNA candidates could be tested for their immune response. So there are a couple of approaches that we undertook simultaneously, and only just 3 or 4 years ago, so not all that long ago, and just a week or two ago, we had a publication from one of our first investments in Nature Communications, which really represents a breakthrough in the approach to treatment of HIV. So we're starting to see the benefits of the work that we've undertaken.
Absolutely, and I think a lot of people in Victoria are starting to see the fruits. Now, tell me, you opened the KCA Knowledge Commercialisation Australia Limited. Can you tell me something about that?
So Knowledge Commercialisation Australia is a national body here in Australia that brings together the technology transfer specialists from across Australia's universities and research institutes. And I was invited to give a keynote at their conference a couple of years ago now, where I talked about jobs for my grandchildren, which is, I think, a topic that we can all relate to, or many of us can relate to, certainly of our vintage. And it was really saying that, of course, reflecting that many of us enter this industry to really make a difference, but importantly, to create those future industries and bring science to bear on the problems that industry faces. And that was really the topic of my keynote, was to reflect on how important it is for both the research push from our universities, but also the engagement with industry and the industry pull that brings research and capabilities to bear on the problems that industry is trying to solve.
Absolutely, and I think you've spoken publicly about wanting jobs for your grandchildren. So what kind of skill sets or scientific domains do you believe Australia and the world should be investing in now to ensure prosperity and preparedness over the next 20 years?
So I think, one of the areas that we're working on here in Melbourne, as well as around Australia, is to increase the number of students undertaking STEM degrees or STEM subjects, because not everyone needs a degree in science, although a science degree can really underpin so many different professions. And so we are focused on both at the tertiary level to increase engagement and ensure that students have a satisfying career in science, because that is a primary driver for students wanting to take a subject, because they want to understand what kind of job they would be able to achieve or undertake on completion of their degree. So we really need to support the industry. That's why the biotech industry and the work that I've been doing over the past 25 years has been important, because I can remember as a student myself when I went for course advice and I said that I wanted to do pharmacology, and the response was, well, why would you want to do that? There are no jobs in industry. So that's been my raison d'etre for a very long time, and has led me to where I am today. So I have not ever forgotten that experience. And so whether it's biotech, whether it's quantum technologies, whether it's critical minerals, I don't really care I do care, but it doesn't really matter what the ultimate job is. It's about having the talent with the passion to really engage with the subject matter and be good corporate citizens in advancing the technology in a way that benefits everybody. So that's what we're doing at the tertiary level. And then earlier on, of course, it's not too late, but it's really important to really ensure that we capture the passion at a very early age. So I work with my colleagues in the Department of Education and Training to support initiatives that are aimed at preschool children as well as primary school age children and secondary school age children, so that we actually have points of intervention right along the supply chain or of our next generation, so that we're not leaving it until oftentimes people have already chosen their subjects, but to get them whilst they're young.
I think for me, as chair of the Victorian Quantum Technology Network, how do you see emerging fields like quantum sensing and synthetic biology impacting on the health or the agri-tech or manufacturing in Victoria? And I think that that's something that you've also haven't mentioned, I think because of your modesty. So I think that this is something that's very important that's going on in Victoria, people may not be aware of. Can you tell me something about Quantum Technology Network?
So the Victorian Quantum Technology Network is really brings together Melbourne's expertise around quantum technologies, and it had an initial focus around quantum computation and particularly around algorithm development. So how do we think about how coding effectively in
Yes.
a quantum computing sense? So, but it's not just about quantum computing, and quantum technologies covers a wide range of different verticals, if you like. So sensing and imaging is one where Victoria has particular expertise at the University of Melbourne and RMIT University. So, so we've been working with our sensing and imaging experts at those universities, and they've been developing a wide range of applications for health and medical applications. So for whether that's imaging or quantitative analysis of blood samples. And so there are health applications of quantum sensing and imaging. Perhaps the other area that is worth mentioning, and it relates to Australia's broader interests in resources, is around sensing and imaging for mineral exploration. So for understanding what's below the ground in a more granular manner, as well as navigation. So everyone and in over recent times, and I'm talking now over the last 5 or 10 years, not just over recent months, has been interested in navigation in GPS denied environments. And so that is a particularly interesting application of sensing and imaging that people here in Melbourne are progressing, as well as others around Australia.
Dr. Caples, you've helped steer major funds like Breakthrough Victoria. What distinguishes catalytic public investment from just mere subsidy? Because I think I would like to talk to you about this Breakthrough Victoria funding. Could you tell me something about it?
Okay, so Breakthrough Victoria had its origins in work that we did here in Melbourne over 20 years ago, where we invested in what is known as or what was known at the time as the Science, Technology and Innovation Initiative. And this was delivered via grant funding, and what it sought to do was not so much invest in basic research, but in the tools, the technologies, and the translational capabilities that are needed to convert science and technology into economic outcomes, into products and services that actually can support industry and of course the research community, but can also support the development of products and services. So what occurred with Breakthrough Victoria was that we did something different. So Breakthrough Victoria is about what is appropriate in the 2020s as opposed to the 2000s when we had the STI initiative. But the overall objectives are essentially the same, which is around building capability in the state
Yes.
for economic outcomes, for
Yep.
social outcomes as well, which is, it's investing as a government is different to investing as a private sector investor who is mostly interested in the financial returns. Government is interested in financial
Yes.
returns, but of course is interested in broader outcomes, and that's the key difference between a government investment vehicle and a strictly private sector vehicle.
Absolutely. We want social improvement. We want social outcomes, things that we don't often see in our lifetimes and things that benefit future generations. So speaking of the past and the future, how had the pandemic changed the tempo and expectations of translational research in Australia? How are we more ambitious now and more cautious?
Very good question. I think it really has caused people to think, to be a bit more deliberate and to really be clearer on what outcomes the research that they're undertaking
Yes.
can achieve. And I think it has made people feel just a little bit more pressured time-wise. Time is of the essence, and I think we've now got the capabilities that do allow us to advance at a faster pace. And we just need to look at the availability of AI, for example. Next week we have an event here in Melbourne, which is looking at increasing awareness of the applications of AI for drug discovery and for clinical trials, patient selection, site selection, and so forth. And so I think that the combination of, and we must remember that AI is still relatively immature. There's a long way to go with AI, so I don't want to overstate the case. But that it is of, I can remember talking about AI 10 years ago, and it certainly was not ready then. Now it is at a point where major pharmaceutical companies are using the technology right across the business, and that has enabled researchers and industry to move faster than they've previously been able to do, as well as be able to de-risk, take some of the risk out of their development projects or pathways because they have additional and more precise information about what their lead candidate can do. And for the pharmaceutical industry, that's so important, as you know, because it's hitherto been pretty much a black box exercise, and understanding what happens at the molecular level is really, really important.
So what would be some of the more profound legacies from the pandemic, the COVID pandemic?
So one of the major legacies of the pandemic is the contribution that the Peter Doherty Institute for Infection and Immunity made to not only the Australian response, but also the global response. And that's covered both public health, and advice around community measures to mitigate the spread of disease, as well as therapeutic approaches. And so the role of the Peter Doherty has caught the attention of international investors. And so not only have we an ongoing legacy of expertise in relation to addressing the pandemics and variants of concern, but a Canadian investor chose the Doherty Institute to make a significant investment in what is known as the Coming Global Centre for Pandemic Therapeutics. So we all know about vaccines for infectious diseases, and many of us know that we also have a need for treatments as well as vaccines. And so Jeff Cumming chose Melbourne and the Peter Doherty Institute to make a very, very significant investment. And right now, the Peter Doherty Institute is recruiting globally for people to deliver on this initiative.
I think it's
So
one
that's
of the most,
pretty exciting.
it is a very impressive, I think, what's going on in Victoria. So Victoria's made some bold bets on research commercialization that you've described, some, and from a quantum to digital diagnostics. But how do you measure success across time? I mean, are we doing enough to track patient-reported outcomes, health system cost offsets, jobs created from early stage science bets? I think Victoria is probably leading the way in Australia on most of these things, to be quite honest with you, and for a variety of reasons. But do you think we're doing enough, or what else could be done?
I don't think we're doing enough. I think that we have we know what to do. It's and it's about prospective measurement. You know, really setting ahead of time the outputs and the outcomes that we're seeking to achieve, and that's what we did 20 years ago when we implemented the STI initiative. Is that we prospectively captured data. And part of the difficulty in capturing that data is that it gives you information about the impact of the actual expenditure of the monies involved. But oftentimes, and it doesn't matter what area of science, it takes time for that expenditure to have impact. And so there is a secondary wave, if you like, of impact that reflects the investment effect. So that's part of the difficulty in measuring the outcomes, is because you do need to wait at least another 3 years beyond the period of funding to have confidence that you've actually captured the lion's share of the impact of that investment. And of course, once a researcher stops receiving funding, it's natural that they're less likely to provide you with the data that you need in order to capture the full picture. We've tried. We know that it does work, and you can feed that kind of information into economic models that help you identify what the impacts have been. But of course, it's always a challenge for public sector agencies to fund such data collection, because it requires ongoing effort beyond the period of the initiative. So there's some of the reasons why we know what to do. Our challenge is about getting the authorising environment to enable that to be fully implemented.
Absolutely. I think it's all about investing in the future. Imagine it's 2035. What's one thing that you hope we've achieved in Victoria's science and health innovation system that seems aspirational today to you?
So I think it's about really being more definitive about the areas of specialisation that we're going to pursue. And so as a state within, so we're a federation within the Commonwealth of Australia, one of the things that we've been talking about in recent times and has occurred over a number of years now is how we better coordinate our respective investments in technology ecosystems. And so Victoria has led the way with our commitment around biotech, and we've, I think, demonstrated the principle that if you specialise in a technology area for a sufficiently long period of time in an area where you've got core capability, and we started with 45% of Australia's health and medical research, then it can be done. And that whilst other states can also have capability in this area, that they can choose to specialise or not. And so we know that it works. And for us here in Australia, and we're only 1 to 2% of the world market, we're too small to compete with each other across the different states. And so if we could have a national network of basic capability, and we have that already, which I think is a great achievement for both the Commonwealth Government of Australia as well as the contributions from other states. But having a position where Victoria, for example, chooses quantum sensing and imaging as the specialisation that we're going to focus on, with other states, Queensland or New South Wales, specialising in quantum computation or whatever it might be, that I think would be, if we could achieve a situation in 2035 where there was a broad gentlemen and ladies agreement that Melbourne would focus on this, Sydney would focus on that, Brisbane would focus on that, and that's not to say that we can't individually have expertise in a particular area, have a baseline, but that we we adapt our approach in recognition of what is special about us, and that we can't all be special.
I couldn't agree more. I think that's very beautifully articulated. Thank you. Dr. Caples, can you tell me something about the legacy that's being left by Victoria and yourselves about the mental health of its citizens?
Yes. So mental health is an area that affects everybody really, and something that really came to the fore during and post the pandemic, because of course anxiety and the fact that we were not able to engage with each other according to our preferences. And so initially, the first year after the pandemic, there was a lot of transition that needed to happen, particularly for our young people who were not able to experience the usual way of growing up in society. And so we're still dealing with the mental health impact of not only the pandemic, but of the ongoing pressures of living in a technological age. And so the Victorian government has undertaken a broad analysis of the mental health needs, and is working on developing new pathways for better treatment outcomes for mental health. And the reason why I mention this, and it's not an area that I have had a long-standing engagement with, but in recent times and with the development of technology, the ability to monitor patients and look at their treatments through the phone. Let's use the technology that is at our fingertips, and particularly for young people, if there are ways in which we can use digital health applications in a format that is familiar and acceptable to the to the young generation, then we've got a greater chance of improving the outcomes through means that had not previously been considered. So certainly digital health, digital mental health, how can we apply technology to to not to to not only engage with the community, but use as a tool to determine the impact of new approaches to mental health. So that's an area that here in Victoria, others, the expertise that we have here is really trying to double down and address what is a significant health issue, not just here in Melbourne, but across Australia and around the world.
Absolutely. And I think that the impact that you've made, well, the impact that's being measured in Victoria is going to be a stalwart or a hallmark for a number of organisations. I think that in summarising yourself, I mean, you've helped steer over 2 billion in science and innovation funding, positioning Victoria as a global leader in pandemic preparedness, but messenger RNA work, digital health, translational science, and you've led strategic foresight, I think, around jobs for the future and jobs of the future. Institutional design, I think, across a broader science collaboration is something you've been able to facilitate in Victoria. When you mentioned your 45% of Australia's research, I thought that's fairly telling, I would say. I've very much enjoyed our conversation today. You're one of Australia's foremost regional science and innovation policy leaders, currently serving as Victoria's lead scientist with over 2 decades of experience in public service. And I'm very proud that people like you exist in Australia from my background. So I wanted to thank you very much for your time today. And I hope to talk to you again in another 12 months, 6 to 12 months, about the progress that you're making with other groundbreaking opportunities that are presented on your desk. And thank you very much for your time today.
Thank you, Stephen. It's been a pleasure.